So I usually ask them just to kind of tell me how they got here. And as they kind of relive some of the things they've been through during active addiction, trial and error, it helps them tap into what their needs are in the family. What are some things that we need? And a lot of times they really just want communication. They want safety, they want peace, and they want to know that their loved one is okay. So one of the things we do in our family education group is a family first step. It's a really good exercise to help families look at what are some things that I've been doing to try to help my loved one? And are those things working? So then we take them through the first step of, okay, I recognize that I am powerless in this situation, but that doesn't mean I don't have any power. I'm powerless over some of the feelings that have come up over the course of time. Guilt, shame, feeling manipulated, feeling hurt, feeling out of control. And these are all the things that I've tried to do to help my loved one, to fix, control, to rescue.
So that unmanageability, they act out in a lot of different ways. They don't see it as unmanageability. They're trying to control the situation, but they can't. What would manageability look like to you? Well, if my family member would get sober, then I could manage my life. So we have to go and debunk that mystery there and say, well, what if you got better and they didn't? Because sometimes that happens.
And so as we look at that family first step, we begin to weed out some things that are not actually helping, and we incorporate things that do help. And some of those things are boundaries, communication, recognizing what's mine and recognizing what's theirs. The first step in establishing boundaries is establishing what my needs are. If you don't know what your needs are, if you don't know how you're feeling, it's going to be very difficult to begin setting boundaries. A lot of times people want to set boundaries when they're angry or frustrated, but after you calm down, you may realize that's not actually the boundary that I want to set. Boundaries can be flexible, changeable, and removable. And that kind of takes a lot of pressure off of people to get it right the first time. Boundaries are trial and error. What I may need in the beginning of my loved one's recovery, I may not need 6 months from now. And so just knowing that at any time I can change my boundary, I can adjust it or remove it altogether if it's no longer working, gives people a more confidence to even start talking about setting boundaries.
Good people set boundaries. And boundaries are not a punishment or anything. It's how we treat each other. It's respect. I want to respect you, and I want respect in return. I respect you, you live in the house, and I need to know what time you're going to come, what time you're leaving, and when you do that, I appreciate it. So I might request one thing, and then I appreciate it.
Family roles, I think, is important. It's a really cool exercise. Families really enjoy it because it helps them look at what is my role in the family system? Am I the caretaker? Am I the hero that wants to fix everything? Am I the one that tries to make everybody happy, make everybody laugh and distract? Or am I the one that gets all the blame when things go wrong? So when we look at those family roles, what we're looking at is how do we cope in stressful situations? And how I cope determines how I might show up to a problem. I might try to fix it, make it easier for people. I might try to enable and rescue. These roles are natural and they're not good, bad, right, or wrong. They just are. And so while I may be inclined to be the fixer and the helper in my family, once I recognize what some of my behaviors are, I can determine, is this necessary in the moment? Or do I need to take a step back and work on some boundaries? What I have found is by the time families come to us, they're ready to let go of those roles. They're tired. They want to do something different. And so having a name to what they've been doing and what they've been experiencing can be very helpful. The most common analogy is like the dirty fish tank. Like if the fish tank is dirty and all the fish are living in that tank, if we take one fish out and put it in some clean water, they'll thrive, they do well. But what happens when we put that fish back in the dirty tank? And that's the family system.
So much of addiction is generational. When family members come, we help them see that, the generational pull of addiction and all of these other dysfunctions that they're facing. When we do family roles, when we do genograms, that's a very important piece. It's an eye-opener for family members and for patients. We use the example Grandma always cut off the end of her ham when she cooked it. And we go, the mother, Mom, why are you cutting off the end of the ham? Because that's how Grandmama did it. So you go back and someone asks, well, Grandma, why did you cut off the end of the ham before you cooked it? She says, I didn't have a big enough pot to put the ham in. So we keep these traditions going when they no longer serve us. Just knowing or using the genogram is eye-opening for people, and it releases them from some of that shame, blame, and guilt. You don't know what you don't know, and you can't do what you've never been taught. You can't have a perspective if you were blind.
One of my first questions I ask is, how do we incorporate recovery into the relationship? So that looks like family planning with some safety contracts. We got a big family event coming up and, someone may be triggered in the family. How do we come together to talk about, how we can support each other through those transitions? There's a need for continued support for loved ones and family members. And so one of the things we've been seeing is that even if their loved ones are chronically relapsing, families are still showing up each week. And I mean months after their loved ones have completed treatment, because it's working and it's helping. We're helping people communicate. Probably for the first time, we're helping people address their grief, sometimes even their trauma. We're getting people into treatment. We're getting people into therapy. So there's so much good coming out of just attending one of those meetings.